All right, y'all, Dr. Pierre here. Welcome to another episode of Medicine Mondays. Last week, we got on our political bag talking about the importance of the Affordable Care Act and where would we be without it. I suggest if you don't know, go ahead, check last week's episode out. Make sure you subscribe to, especially my YouTube channel. If you're a podcast listener, make sure you subscribe to that as well. Now, this week, we're going to talk about the importance of taking advantage of these preventative services that are available. One, obviously, we'll talk about what these preventative services are and why you need to take advantage of them. It'll be self-explanatory as we discuss because, right, and again, I stress this, election season's coming around. People are, making statements like they want to get rid of, Affordable Care Act, a.k.a. Obamacare. And we know that if they get rid of those, these same preventative services that you can get for free or do for free or at an extremely low cost right now is not going to be there. And the ultimate consequence of that is death. Right? I want to make sure we stress that. Like the ultimate consequence of not taking advantage of preventative health services is death. So let's talk about what are these preventative health services? Why are they so important? And more importantly, what do you need to do? Which one should you take advantage of and when? Right? Because I think it's important. Like there's so many of them. Like what should you be taking advantage of? How should you be taking advantage of it? And when you should start doing these things here. All right. So let's talk about the basics of preventative health care and why is it so important. So if you had to do some bullet points, like what lies under preventative health services? Screening exams, vaccinations, and lifestyle modifications. That's like the umbrella where most of your services and programs are going to fall under. And if you're taking advantage of these, guess what? Like you can live longer, more importantly, live healthier, right? Because there's no point to live longer if you're not living healthier. Like, trust me, I take care of a lot of sick people who did not take advantage of their preventative health services. And medicine, let me tell you one thing, and I say this all the time, medicine is great at keeping you around. Now, we're not saying we're great at keeping you around and you could still cut a jig. We're just great at keeping you around. So we will do things. We got medications, we got machines, we got things that will keep you around here in misery, but you're still alive, right? And for the most people I talk to, they're not trying to live like that, right? They want to be around, but they want to be able to around to have fun, experience, great time with their family and their loved ones. They want to do that. They don't want to just be bed bound and not be able to do that thing, sickly all the time, in the hospital, in and out. They don't want to do that, right? So it starts with the screenings, starts with the vaccinations, starts with your lifestyle modifications. I know my lifestyle modification warriors will love that because I think a lot of times, and I say this a lot when I do my lives, a lot of times people will stress that us physicians are always pushing the first two, right? And never pushing the third. We're like, oh, we always want you to get vaccinated. We always want you to, do some tests, but you never talk about, eating better and like, no. We want you to do all three of these things, right? We need you to do all three of these things if you are actually trying to take advantage of these preventative health services, right? So, and it's so important, especially with the Affordable Care Act, the fact that a lot of these services are low cost and or free. We got to take advantage of it, especially when we have people talking crazy like they want to get rid of it. Because the stats and numbers show if we take advantage of these preventative health services, we live longer, we live healthier, more fruitful lives, we make some more money, right? And I'll put a couple of those studies in our show notes, but like the studies are there. Like you got to take advantage of these opportunities that are available while people are still like trying to argue whether they should be available for everyone. And I talked about it last week. That's probably the most concerning aspect of it all, that people in my ilk who have access, have income, have finances, have the wherewithal to be able to travel wherever they want, right? AKA, my folks who are against women's choice, right? But have no problem if that thing happens to their family, know that they can just fly to a different state and have that procedure. You know what I'm talking about, right? Those people right here, right, are telling you that preventative health services shouldn't be covered. They shouldn't, I shouldn't have to pay for it. It's unconstitutional. That's what they're doing now, right? And we have to, as a proponent for our patients, as now I'm talking to the healthcare providers, as a proponent to our patients, we got to fight for that. Like it's just different type of crazy, right? So that's kind of the basics of what these preventative health measures are and why you should take care of them. All right, so let's break down, each of the three section measures of preventative health services. So first and foremost, let's talk about the screenings. Let's talk about just going to the doctor and making sure you know what your blood pressure is. How many of you right now, whether you're watching me or listening to this on the podcast had not checked your blood pressure in the past 2 weeks? And don't be embarrassed. Don't be embarrassed. You can say it to yourself or you can drop it in the comments. But how many of you could not tell me what your blood pressure is in the past 2 weeks, even though, and I'm not even talking about you going to the doctor, even though you've passed so many grocery stores or pharmacies, right, that have those free machines in the office? Like, how many of you? So think about that. So when we talk about preventative health screenings, we're not talking about, all of these, fancy $1 million tests. These are simple things that we know if we can take advantage of it now. Like if I just know what your blood pressure is now, guess what? I can do something about it now instead of having to deal with the complications later, right? If I know what your blood sugars are now, I can deal with it now instead of having to deal with the complications later, right? So when we think about screenings or just preventative services in general, I want to take care of the things now while they're small, while they're cheaper. Hey, insurance company, listen to this. While they are cheaper rather than deal with it when they are huge and more expensive. Hey, insurance companies, do you hear that, right? Because if you ask them, for some crazy reason, before the Affordable Care Act plan, they had no problem like trying to fight you from getting these preventative services and denying claims and, just denying people on the insurance plan. And they figured, we'll just deal with it later, until they got to the point where they had to keep dealing with it later. And of course, they were shielded, right? Because if you're uninsured, guess what happens? Like you go to the emergency room, we may ask you for your insurance, but we're not going to say, oh, you don't have insurance? I'm sorry, we can't do that procedure. Well, we got to send you out. Maybe you could follow up. Like we don't do that in insurance. So if it's an emergency, and I do have to stress if it's an emergency, because if it's not an emergency and you don't have insurance, you best believe that they're going to find a way to kick you out. I'll just be honest. We can have a whole episode on that, but like for now, we'll just tell the truth now, right? So you have these instances where these companies recognize, all right, if I just take advantage of the free stuff now, aka if I pay for the preventative services now, I'm gonna save so much money in the long end. Like why not do it before, right? So you have these preventative services like just getting your checkup, just getting some blood work done, just making sure what your blood pressure is, right? And then when I talk about some of the other little bit more in quote unquote invasive or non-invasive, your screening mammograms, your screening colonoscopies, right? Make sure you don't have colon cancer, making sure screening for depression, making sure you're screening for obesity, making sure, again, these are all screening things, right? There was a time where they did not pay for these things. And it's wild to think that now, especially, and I have to say screening because if it's diagnostic, aka you have a problem, then, this is more insurance, they don't pay, they pay copay, whatnot. But like for now, right, we're just assuming clean bill of health, you just need to get this test done. They now pay for CT exams of the chest if you have a history of smoking, just to make sure you don't have lung cancer. Why? Because they realize like, hey, if I can get this thing early, I'll save me much more money now than having to spend it later, right? Again, these guys, and when I say guys, these insurance companies, they're not altruistic with it. They just realize from their capitalistic standpoint that saving money is a good thing versus spending money. They saw, hey, we can save money over here if we just pay for the preventative services. Oh, of course. Why wouldn't we do that? Which is why so many more primary care providers and more pediatricians and family physicians and internists like now get higher rates of pay, because they say, hey, you know what? Let's pay them a little more too, right? Let's pay the doctors who got to take care of these people. Let's pay them a little more too to incentivize them to do these preventative services, because guess what? It saves us money in the long run, right? So like those are your big ones, your mammograms, your colonoscopies, your screening for depression, your screening for anxiety. There's a lot of different screening modalities that go down. I could put a chart in the show notes for you if you want a handout. Just drop it in the comments. I can make a handout for you as well too, right? And I do want to stress this, right? Especially for my Lunch and Learn listeners, my Medicine Money watchers, right? Anytime you want like a little handout, you want, hey, Dr. Pierre, can you make a handout on this episode? Just let me know. Usually it has to be like a spur of the moment where I like proactively will make one. Like I think we made one for our Think Like a Doctor series, right? Make sure you check that out. But if you want a handout created by, well, not necessarily created, but derived by yours truly, just let me know in the comments and I'll make one for you. So going back, so we got our screening exams that need to be taken care of. Vaccinations, of course, you've been hearing me talk about this for almost like a decade plus now, of making sure your vaccinations. Again, I'm an adult doctor, so I'm going to be talking about the flu. I'm going to be talking about obviously COVID vaccine, pneumonia vaccine. There's RSV vaccine. Like these are the vaccines, and for people who may need to get caught up on some of their earlier vaccines that they might have gotten as a child, get your vaccine. vaccines, right? Because again, it is much easier to deal with the preventative aspects of it, so that even if you do come in contact, the severity is going to be likely less if you are already protected versus having to deal with the disease full head on, right? And again, I got plenty of episodes talking about COVID vaccine, so you already know where I stand on that. Definitely pro-vaccine for sure. And this is the big one: lifestyle modifications, right? And I want to scream this from the rooftop, right? Because the people who are so anti-doctor, who swear that we just are pill pushers and we're paid by big pharma, swear that we never focus on this. No, this is usually number one, right? We usually want you to modify your lifestyle, whether it be sleeping more, whether it be exercising more, whether it be eating more nutritional balanced foods, right? Or, getting rid of some of those foods that you should be, especially my diabetics, my hypertensive patients, getting rid of the foods that you should be getting rid of, right? We always want the lifestyle modification. Now, again, if we give you medications, it's because we recognize that lifestyle modifications ain't going to be enough, or it's not going to be a quick enough turnaround time, right? So yes, we want you to do both, right? Because at the end of the day, I would love for you to do the combination of a lifestyle modification, then medication, and then you do so great with it. Guess what? I can pull away. I'm not going to pull away and say, hey, stop doing the lifestyle modification. I'm going to pull away the medication, right? So lifestyle modification is something that we champion, is something that you need to take advantage of. And because of the Affordable Care Act plan, Obamacare, there are a lot of services, dietitians, nutritional services that are covered with your insurance now, because guess what? They recognize, like, we'll save money if we focus on these things, right? Again, it's a novel idea. Hey, like, take care of the people who pay their premium and they'll live longer, live healthier, and then you won't have to spend as much money in the end. Again, I'm not in that business, so again, they don't have a lot of people who have common sense like yours truly has common sense, right? So those are the three things, right? Getting your screenings and checkups, getting your vaccinations, and healthy lifestyle choices, diet, exercise, avoiding the bad things, cigarette smoking. Why are you still smoking cigarettes? I don't know. Avoiding those things at all costs. Those are the things that we have to take advantage of when we scream preventative health measures. Those are the three things you need to think about. And I talked about kind of the benefits, kind of along with these preventative health services. Of course, you're going to live longer, right? Can we start there, right? That you'll live longer, right? If you actually take advantage of these preventative health services, you're going to live healthier. You're going to spend less money. It's going to save you money. And number 4, you're going to live longer, right? Like, you're going to live longer. Like live longer should be the most important thing, but more importantly, live healthier, right? You're going to live a more healthier lifestyle, a lifestyle that you actually enjoy when you're older and, not bedbound or just backaches and like, you're going to actually want to enjoy your life as it continues to move on. And you can do so if you take advantage of the lifestyle modifications. If you take sure of making sure you're as healthy as you can be, so you're not missing work, you're making all the money that you want to make, you're taking the vacation that you want to take care of. You can do these things here, but you got to take care of the home base. You got to take care of the foundation, right? That's where preventative health services is taking care of your foundation as far as your health is concerned. Like, again, you listen to Dr. Barry Pierre, because Dr. Barry Pierre is going to give you what you need, right, to help think like a doctor. The motto, empower yourself for better health, right? He's going to do these things because he wants to make sure your foundation is solid, so that when you're 40, 45, 50, 55, 60, right, you're just dancing around, you're going on vacations, you're doing all the things you want to do with yourself, with your loved ones, with your family, and not feel like you're hindered by all of your medications and you're hindered by all of your medical disorders and diseases, right? I don't want you to live like that. You don't want to live like that, I hope, right? So again, understand that the benefits of taking advantage of these preventative health services are key and are so monumental that if you ask anyone who is, a little bit older, a little bit more seasoned, some of the things that they wish they could have done, they'll always go back to saying, man, I wish I could have took care of myself when I was a little bit younger. I wish I took a little bit better care of myself. And how do you do that? You take care of these preventative health services that are available for you right now, right? Like, while people are still like trying to argue and take them away from you. All right, you may say, Dr. Barry, how do I implement these things, right? So if you want to say, you know what, I listened to this episode, Dr. Barry told me I need to get right. I'm about to get right with myself. What are the first steps I need to do? First thing I always say is you got to think like a doctor, right? We have to create your own type of health plan, and you can do it. In fact, I encourage you to do it with the assistance presence of a healthcare provider. That way, that healthcare provider can let you know, okay, because of your age, because of your family history, these are the things we need to take care of. Like, we need to make sure your blood pressure is in check. We need to make sure your diabetes, your cholesterol. We need to make sure all of these things, screening, are available. We need to make sure if you're due for a colonoscopy, you get it done. If you're due for a mammogram, ladies, you get it done. If you're due for your pap smears, you get it done. We need to make sure all of these screenings are intact. Then we got to make sure from a vaccination schedule, are you up to date to your vaccine? Do you have some of the risk factors that may require you to take one vaccine versus another? Is there a vaccine you should avoid based on history, right? These are all things I want you to take advantage of in the counsel of a healthcare provider, right? Because again, it's another thing to have these things available, but have a plan of attack on how to make sure your foundation, your health foundation, is intact, right? You got to do it, right? We have to set realistic goals. Think about that. You have to set some realistic goals. And I scream this all the time, especially when we talk about New Year's resolutions. You got to set these realistic goals of what you're going to do, how you're going to do it. When are you going to get these things checked off on your list, right? Don't tell yourself like, all right, I'm going to get off my meds in 3 months, and that's not possible, right? You've been a raging diabetic for years. It ain't happening, right? Don't tell yourself like, I'm going to get off all my blood pressure medications with just, diet and exercise when, your family history says you're likely not going to. Like, so we got to set some realistic goals, but that's when your healthcare provider and your counselor and your coach, right? Because I know some people have health coaches. In fact, we have an episode on health coaches versus doctors, right? Like, it was a good episode. Definitely, I'll put a link in the show notes, right? Because I definitely think it's one you should check out. We think that we need to just do all of these things at once, but we have to be real with ourselves and say, what can I do? What is possible, right? So we don't want to set ourselves up for failure, because if we set ourselves up for failure, guess what? We stop doing it. We say, you know what? I tried to lose 100 pounds in 5 days. It didn't work. I can't lose weight. Forget this lifestyle modification. Like, we will do that to ourselves. I don't want us to do that to ourselves, right? I want us to get ourselves together and on point, because I think that's what you got to do. That's what you got to do, right? So we got to set some realistic goals, and then stay informed, right? Like, how do you stay informed? Guess what? You listen to, the Lunch Learn with Dr. Barry, or you're subscribed to Medicine Mondays with Dr. Barry, right? Because you want to stay informed with what's going on in healthcare, right? So if any new news pop up on blood pressure, diabetes, cholesterol, stroke risk, cancer risk, guess what? You come to, a healthcare provider who's online like myself. Make sure you subscribe, y'all, right? You come to me because you want to make sure you are as informed as possible. Then you go to your healthcare provider, because remember, like, I'm a healthcare provider. I'm not your healthcare provider, right? Think about it. I stole that from my wife. My wife always says that, right? Like, I'm a therapist, but I'm not your therapist, right? Shout out to my wife. So remember, I'm a healthcare provider, not your healthcare provider, right? So yes, you take the information that you get from me, but then you apply that. Y'all get the most informed news from your boy right here. And then you go to your healthcare provider and say, all right, Dr. Barry just said this. Like, let's make sure that, he hasn't gone off the deep end, right? I won't, but like, this just makes sure that happens, right? So those things are extremely important. Getting a health plan, sitting down with a healthcare provider or coach, set realistic goals, and learning how can I stay informed with truthful and factual information, because that is how we take advantage of all of these services that are in front of us. So what? We can live longer, live healthier, live happier. All right, so to conclude, preventative health measures are the backbone, the foundation to live a happier and healthier life. I encourage you today to follow up with your healthcare provider, your healthcare coach, to say, all right, what are the things I need to do today to make sure that in 5, 10, 15, 20 years, I can still cut that jig, right? I can still dance. I can still scream the night away. Like, I want to still do these things in 5 to 15 years. I don't want to be bedbound. I don't want to be living in misery, hurting all the time. I don't want to do that. That's not me, right? Like, if that's your future, right? You're telling yourself, hey, you know what? I want to be one of those lively 50, 60, 70-year-olds. Like they just look like they're just always happy with life. You got to take care of these things, right? You got to take care of your health foundation. This is how we think like a doctor, right? We keep telling ourselves, these are the things I need to do, right, to live a fuller and happier life. So I got to do them. Right? I got to get my checkups, right? I got to screen for the high blood pressure, screen for the diabetes, screen for the cervical cancer, breast cancer, colon cancer, prostate cancer, lung cancer. I got to do all of these screenings, depression, anxiety, all of these screenings, obesity, all of these screenings. I got to get my vaccines. I got to get vaccinated. I'm going to stay informed. I'm not going to listen to crazy say that the vaccine is, has radiation in it. And I'm not going to listen to those crazy. Guess what? Because I follow Dr. Barry Pierre, and he has not steered me wrong in a decade since he's been doing this thing. And I hope they continue doing so. Stay tuned next week for another amazing episode. We're yours truly, Dr. Barry Pierre. Make sure you are subscribed to all of our platforms, whether it be the podcast or our YouTube channel. Thank you.